Interesting you say that. We've had one or two reports over the past few days, in fact, two reports today, where one was Clicks, one was in the Midrand as well, where we had people who were basically just going to the site and there was no regulation. They got their jabs and they weren't on the list. Is this project just too mammoth, and do we need to move with speed to stop that from happening?
Well, that's exactly the right question. There's no doubt that we started phase 2, which is the over 60s. There's 5.5 million over 60s, and the balance of the healthcare workers who weren't vaccinated in the systolic trial. There's about 500,000 of those healthcare workers. We need to vaccinate them as quickly as possible, hopefully before the onset of winter and before we have the challenges of the third wave. And in that particular context, we needed to get sites up and running. So from the beginning of this week to yesterday, I can tell you that by yesterday, we had 177 sites, 155 in the public sector, 22 in the private sector, vaccinating 117,000 people. We've got 1.6 million over 60-year-olds who've registered. But the reality is this is a project on a size and scale that we've not seen in this country effectively since 1994. All of us need to come to the party. There were bound to be some teething problems, and I think we'll experience them hopefully on a diminished basis over the next few days, maybe the next couple of weeks. So there were some pharmacies that had the vaccine and opened their doors to whoever was prepared to be jabbed. And although that isn't in accordance with the protocols and the arrangements, if the vaccine otherwise is going to go to waste, we would rather that every adult in the country gets vaccinated as soon as possible. But what is more important is that as soon as the program is really up and running, which I think will happen in the coming week, that we concentrate our efforts on the over 60s. Our work that has been done in the country so far suggests that although over 60s only represent 9% of the total population, so far from COVID-19 it represents 36% of those who were admitted to hospital and 60% of those who unfortunately died. You're 6.5 times more likely to die if you're over 60 than you are the average from COVID-19. So that is our primary task, and what we're exhorting everybody to do is to ensure that as many people as they know who are over 60 get registered, that we can bring those sites on stream, and then those who have registered get encouraged to be vaccinated. I think that in a couple of weeks' time we'll be having a very different conversation from the one that we're having this evening.
News.
Experts.
Analysis.
Where things stand.
What you need to know. Drive home with John Perlman
On 702.